good morning, and welcome back to Grits and Greens and a brief discussion on Stool. And before I do that, of course, let me present my disclaimers. Fair Use Act under Section 107 of the Copyright Act of 1976, which states allowance is made for fair use of copyrighted material for purposes of commentary, criticism, news reporting, research, education, teaching, and or scholarship. It provides for the legal, non-licensed citation and or incorporation of copyrighted material by others which might be infringing under other circumstances. Next, viewer discretion. The following broadcast contains mature themes and situations intended for adults. Viewer discretion is advised. And just in case, trigger warning. This may be sensitive to some. I understand we are adults. However, there's some conversations that need and will be had. But for those listening or viewing, I wanted to put that disclaimer out there. Now, this may be breakfast time for many of you, so if it is, I suggest you come back at another time. So, that being said, again, happy Sunday, happy September. Those who may come in, please be sure to hit the like button, and those who may catch the replay, any comments you may have, you're welcome to leave them. So we're going to talk about stool. And we will begin with the bowel. The bowel, B-O-W-E-L, is part of our digestive system, and it works to digest the foods that we eat, to absorb the goodness and the nutrients into our bloodstream, then process and expel. And that is what we are going to concentrate on, the expel portion of the waste that the body cannot use. Now, for those of you who may come in, and I may put up a poll, I'm not sure now. Hi there, yes, nomads, how are you? Good to see you. Now, those of you who may want to answer the question, either here or later, have you experienced any issues with being regular or painful? Have you experienced any issues? Because that does happen. Being regular. I can honestly say I'm doing well. Yes, nomads, thank you. Thank you, I am doing well. Please make sure those coming in to please hit the like button if you have not. And for those who would like to join, the memberships are available as well. So, question again is, and I'll start a quick poll, have you had issues with being regular? And I'll put that up there. And as I mentioned, because I am very transparent and honest, there have been times that I have, even though I consume water, fruits, and vegetables, there are often, yes, it is, yes, nomads. At least I believe that it is. There have been times that I myself have had those issues. It's caused me to be late for appointments, and it could go either way. Either it can be extremely difficult to, I'll just say, be moved, or you could go on the different spectrum, and you may have encountered situations where you can't stop moving. So that is what we're going to speak about today. And before I continue, I am going to gift 5 of those memberships that are available. Congratulations to those who may receive one. And if you like, you may renew during that time. And yes, Nomad says yes, extremely difficult if you have to get somewhere. Absolutely, absolutely. And as I've said, I am not a doctor nor in the medical profession, so always, always, always consult with your physician before adding or modifying to your diet or anything that deals with your health. And let me make sure I get, yes, Nomads up here. So I already read off about the bowel and what it is there for. Also, the digestive system works by pushing food through the intestines, which usually takes between, and again, I implore you to always, always, always conduct your own independent, thorough research. Usually takes between 24 to 72 hours. The muscular contraction squeeze the foods through different sections of your intestine. These different sections are separated by bands of muscles, sphincters, which acts as valves. The passage of those foods from one area to the intestines to another is coordinated so that the food stays in a specific area long enough for the gut to do a particular job, absorb fluids, nutrients, and of course, process and expel waste. And that, ladies and gentlemen, will be the topic for this particular live. Now, as I mentioned, I myself have had issues in the past with either having difficulty being moved or difficulty of moving a bit too much. That could be a correlation with several different things. It all depends on your bodies. It could be stress related, and it also could be related to medications, dehydration. There are many factors involved. So now what I'm going to do is attempt to share a couple of videos. And again, this is fair use. And we're talking about a very, very normal process of the body. So trigger warning is there just in case people may need that, because it is, as I mentioned, it's normal, but a lot of people do not like or feel comfortable in speaking about this particular subject. But oftentimes, things that are difficult to speak about or uncomfortable could lead, and I'm saying it could lead to issues in the future, because sometimes out of fear or not really understanding, we don't pay attention to our bodies. That being said, we are going to the first video. And again, thank you to those that have come in and to those who may catch the replay. Fair use. And again, happy Sunday, happy weekend, and happy September to everyone. So this video is entitled 12 Things Your Stool Says About Your Health. And it is courtesy of Health Now.
Can signal some serious problems. So let's see what our body is trying to tell us through our stool. Before we proceed, please note that everything mentioned in this video is unbiased, fact-checked, and reviewed by qualified health professionals. With that said, let's jump in and talk about 12 things your stool says about your health.
Okay. These are going to be 12 things, as you heard, your stool says about your health. Again, consult with your physician because everyone is different.
Number 1, healthy. Let's begin with healthy poop and what it should look like. Of course, we are unique human beings, so our poop might be just as unique. However, there are a few general characteristics that are common to any healthy stool. Do you know the poop emoji? That's the lovely shade of brown our poop should have. It's a result of our bile and the bilirubin pigment that forms after the breakdown of red blood cells.
Now, I'm going to stop that there to ask again an honest question, and you do not have to answer for obvious reasons, but do you make it a practice to actually review your waste to make sure that it is what is deemed to be the healthy color? I know some people, and I used to, I would just do my business, ensure that I was clean, and go.
As for shape, healthy poop should look like a log or a hot dog. Its regular shape is given by our intestines. It should be pain-free and pass effortlessly.
Next, have you experienced the opposite? Meaning, your movement is accompanied by pain, whether slight or severe. These are all questions you may want to ask yourself.
The pungent smell is expected as the bacteria in your stool emit all sorts of gases. In terms of consistency and texture, a healthy poop should be firm, but not rock hard, soft, but not ice cream soft.
And we go back to an uncomfortable or perhaps embarrassing question. Do you actually examine it? You eat and release. So do you, or have you honestly taken time out, especially being adults now, to really examine your waste, the consistency, the smell, the consistency, frequency, which all will be discussed in this video.
It should not pass into too many pieces. A healthy bowel movement means you have your number 2 once or twice a day. Some people might have their stool every other day. It's not ideal, but it's okay. If more than 3 days pass without having your stool, then you're constipated. Last but not least, a healthy poop should take you.
I'm going to let this ad go, but that's very important. Again, something that you need to consult with your physician, because that's something we really should consult with your physician, because as I mentioned, we are all individuals, and this definitely could be different for many people. So keep that in mind when you're viewing these videos, because you just never know. And let us continue.
You might spend more time on the toilet scrolling through your TikTok, but it shouldn't take you more than 15 minutes to get the number 2 done. If it takes you more than 15 minutes, you have a poor bowel movement. Consider eating more fiber, drinking more water, and doing more exercise. Number 2, constipation. Well, if you have less than 3 bowel movements per week, you're constipated. That's clear.
That's another question. Have you ever experienced not being able to move longer than 3 days? I don't know if that's the standard. I've heard that, but I try to go for daily and at least 3 times. And for me, I have been able to do that. Let's continue.
However, struggling to go or spending more than 15 minutes to do your number 2 can also signal a poor bowel movement. Are you familiar with the Bristol stool chart? It's a fun, interactive indicator of the different types of poops people usually do.
Okay, now they're going over this Bristol chart.
It was published back in 1992 based on a 2,000-person study. It's basic, but it makes it easy to understand poop. That came out weird, didn't it? Anyways, the first type of poop on the Bristol stool chart is called marble. It consists of small, hard lumps or pellets that indicate severe constipation.
Right, that's type 1, the marble.
The second type of stool that indicates you're mildly constipated is the caterpillar.
Type 2, the caterpillar.
It's the long-shaped and lumpy sausage that's hard to pass. If you still manage to do your number 2 at least 3 times a week, but always struggle and have these types of stool, you should consider a diet rich in whole grains, fruits, and vegetables. You should also see a doctor or a nutritionist who can help you with a good diet.
And that's something that you all should be doing anyway, speaking to your physician or a dietitian may also be an option for those that are interested.
It's not normal, folks. The problem is usually in what you eat. See a nutritionist about that. Number 3, lack of fiber. If your stool looks like amoebas or soft blobs with clear-cut edges that are hard or easy to pass, you might be lacking fiber. You might notice other signs as well, such as constant hunger after meals, incessant food cravings, low energy levels, problems sleeping, etc.
And this is what I mentioned earlier. And I have been guilty of that because of schedules, because of life, period. We oftentimes neglect what our own bodies are trying to tell us. So even though it may be mundane or an inconvenience, that little voice sometimes may be actually trying to not only tell you, but warn you of something. So try to keep that in mind, to listen to that little voice, or those things within your body, your temple, that may seem a little strange.
Consider adding more fruits to your diet, such as pears, apples, avocados, or raspberries. Veggies such as broccoli, Brussels sprouts, or beets are also high in fiber. Eat more split peas, chickpeas, or lentils.
Those are very good, as well as legumes.
Oats, almonds, and chia seeds should always be on your list.
Absolutely, I mentioned that earlier. I love those as add-ins to my smoothies. I also make my own granola, and I will be doing a video on that in the future.
When can no be a good thing? When you open a
I will go
360
ahead and
checking
look at
account
this
from
ad.
Capital One.
Liking our video so far? Before we move on to the next food, don't forget to hit the like button and subscribe to our channel so you never miss out on our new informative videos. Number 4, inflammation. If your stool is fluffy, mushy, and with ragged edges, it can signal inflammation. When your body
That's extremely important as well. Inflammation.
is dealing with an offending agent like viruses, bacteria, and other toxic chemicals from the environment, it will react in all sorts of ways. We call these ways inflammation. Other symptoms might include abdominal pain, chest pain, fatigue, fever, joint stiffness, etc.
Anytime you experience fatigue, in my opinion, and this is just my opinion, that is something that should never, ever be ignored. Again, that's my opinion, so if you ever experience that, please, again, consider consulting your physician.
If you have this type of stool, followed by one or two of these symptoms, you should seek medical help. Number 5, diarrhea.
We spoke about that earlier. The situation where you're moving longer and in a consistency that is loose.
A soft serve or a Jackson Pollock type stool means you've got the runs. Basically, your stool moved too quickly through your bowels and couldn't form into a healthy type of poop. Diarrhea can have many causes, from bacterial infections to eating upsetting foods, allergies, medication, radiation therapy, or poor absorption of food.
And I had mentioned that earlier. Another thing to take into consideration is how you store your food. Are you looking at expiration dates? Do you examine and inspect your foods for rancid, mold, discoloration? They're telltale signs. So keep that in mind, because you don't want a situation where you may end up unknowingly have food poisoning.
In most cases, it's just something you ate. However, if symptoms such as dark urine, rapid heart rate, headaches, flushed skin, confusion, dizziness, severe nausea, or vomiting follow episodes of diarrhea, you should immediately see a doctor.
Again, always consult with your physician. And I'm going to just go back just really quickly to add, please make sure that you're examining your number 1 or your urine as well. Number 1 for the odor. Number 2, the color. A lot of times there's protein or other bacteria that's found in your urine. Sometimes you may find blood in your urine, so it's very critical, again, in my opinion, to make sure that you're examining not only what you're putting into your bodies, but what actually does come out.
Number 6, gastrointestinal bleeding. A black stool resembling coffee grounds might suggest gastrointestinal bleeding. You might be wondering why black is a sign of blood.
And that's another thing. You may hear this often, and they refer to it as dark or tarry stools.
Well, it took a while for your stool to travel down, so the blood could easily turn darker in the meantime. GI bleeding is a sign of a digestive tract disorder. Other symptoms might include abdominal pain, chest pain, vomiting blood, difficulty breathing, or lightheadedness.
Again, all of these symptoms should be reported to your healthcare physician. Please do not wait. It may be something minor, but you'll never know. So it's best to be safe now rather than sorry later.
Therefore, you should not ignore a black stool. Don't get too scared of it either, because sometimes what we eat can influence the color of our poop.
Which is absolutely true. If you consume big leafy green vegetables, and if you pay attention to what you move, you will see a vibrant green hue or tint to what you expel.
For example, if you've had licorice, foods rich in iron, or iron supplements, bismuth medications, or black stout, they might cause black poop. But if you notice frequent black stool, go see a doctor. Number 7, liver or gallbladder issues. If the stool is white or gray, you might have a problem with your liver or gallbladder. Pale poop suggests
That is another issue that many people experience, and they're not even aware. Liver and gallbladder issues. I've had several friends that actually had to have gallbladder surgery. So keep that in mind.
a lack of bile. Anti-diarrhea medication might be a cause of pale stools. Pancreas or gallbladder problems might also be why your stool does not contain enough bile. If you notice pale stool but have no other symptoms, you could wait and see if your poop returns to its lovely shade of brown. However, if your children or babies have pale white poop, you should immediately rush them to the hospital.
That's another thing, parents. Please make sure that you are examining thoroughly, not just yourselves, but your little ones as well.
Number 8, too much bile or not enough bilirubin. In some cases, your poop might come out in shades of green. It could be because you ate a lot of spinach or kale, but it can also be because of too much bile or insufficient bilirubin. If you haven't eaten too many green foods, your poop might be green because it passed through too fast and couldn't pick up the brown coloring bilirubin. Parasites or bacteria can also cause green poop.
So review those again. If you consume a lot of, as I mentioned earlier, big green leafy vegetables, of course, you should see a green hue or tint. But if you haven't, there could be other reasons why. Not enough bile or bilirubin.
Salmonella, Giardia, or norovirus can make your guts flush quicker than normal, making your stool look green. Crohn's disease or other GI conditions might also make bile move through the intestines.
Now, I also have friends who suffer with Crohn's disease. I don't know too much about that. So those that do, prayers out for you, and this is something that you probably understand and have experienced.
too quickly, so your poop will come out green. Green stools might also be caused by irritable bowel syndrome, ulcerative colitis, or too many laxatives. Number 9, hemorrhoids. If you notice small amounts of red blood in your stool, that might be because of hemorrhoids.
Yes, the dreaded hemorrhoids. Thank God I have never experienced that, but again, I know several people who have, and trust me, they did not seem to be comfortable at all.
Eating berries, beets, or drinking too much tomato juice could also cause your poop to turn into a shade of red. However, once these foods are out of your digestive tract, your stool should return to its normal brown color. So, seeing red blood on the tissue after having your bowel movement is usually a sign of hemorrhoids. If you also feel like some skin is sticking out of the anus after your bowel movements, then you surely have a case of hemorrhoids. It's not a cause of panic or shame. Hemorrhoids are not life-threatening, and they might go away on their own. If they become too uncomfortable, you can go see a proctologist. Number 10, not absorbing bile.
This is why I stopped shopping on Amazon, and you should too. Don't spend another dime on Amazon.
If your stool is orange, it means it's not absorbing enough bile because it's coming too quickly through the digestive tract.
Now that's something I've never experienced, but others may have, so make sure you pay attention to this portion.
Transition can be triggered by several conditions, including irritable bowel syndrome, IBS, short bowel syndrome, SBS, or even diarrhea. Number 11, fat absorption issues. If you have yellow stool, it means your poop contains a lot of fat.
That's something also to be very mindful of.
A fat buildup in the stool can be caused by a lot of things, including issues with bile or enzymes. You should probably see a doctor and do a test. If the results confirm that you have too much fat in your stool, then it means your body cannot absorb the nutrients properly. This is a condition called malabsorption. Malabsorption can point to a series of problems with your intestines, pancreas, or liver.
Your intestines, pancreas, and liver, 3 vital parts of your body that you should never, ever ignore.
In some cases, the pancreas cannot produce enough digestive enzymes to break out the fat. In other cases, the liver cannot produce enough bile to break down these fats for digestion. However, changes in the stool color could also be caused by variations in diet and the foods you eat. If you experience poop color changes that last for more than 2 weeks or have black or red stool often, you should see a doctor. There's no need to panic or think of the worst. Just go see a specialist. It's the best decision you could make. Number 12, food intolerances and allergies.
Another very, very, very important concept. Allergens. Please make sure that when you attend potlucks or people bring things to work, that you are aware of, number 1, what you are allergic to, and if those allergens are a part of the item or items offered to you.
Allergies or specific food intolerances can also affect the stool. For example, people with lactose intolerance will probably experience diarrhea if they eat dairy products. People suffering from celiac disease might have an adverse reaction to gluten, and that can show in the stool. All in all, our stool can tell a lot of things about your body and health. You can also take a sample of your stool for tests to determine if you have any stomach bacteria or diseases.
Now, once you get a certain age, your physician will send you often a little card to test. But those tests are normally to look for certain types of the C word. And that may be done during your physicals.
So, it won't do you any harm to check your poop from time to time. Moreover, you should keep track of how often you do your number 2, how much fiber you eat.
Absolutely. For me, that is a must. I feel as though if I don't hit my goal of 3 a day then there's something wrong.
Or how often you drink water. All these things can have a great effect on your overall health. Mind your poop, folks. Enjoyed this video? Hit the like button and
So I hope that video, and thank you, Yes Nomad. Make sure that I recognize that you were here. Hopefully that video explained a lot of information about bowels, how they work, and the importance of examining your waste, the color, the consistency of your waste, and also some issues you may have. I'm going to present the last video, and this is by one of my favorite content creators, Dr. Ken Berry, and I'm going to extend it a bit, and it's a basic overview of what we just saw, but to bring it home how important it is that we pay attention to, as I mentioned earlier, not only what we consume, but what we expel. If we expel what is considered by health professionals and experts as normal. Thank you to those that came in, and thank you to those who may catch the replay. Again, fair use.
Drinking warm water before bed balances blood sugar levels and reverses type 2. Thousands of people are apparently regaining control of their blood sugar every night as they sleep.
Warning, in this video we will be talking about poop and looking at representations of poop. You have
Okay. As I said, I'm going
all
to
the
send this
criteria
up.
that doctors use is that if you are pooping anywhere from 3 times a day, every day, that's normal, okay? And then the scale moves all the way to pooping once every 3rd day. That is the normal range for human beings' poop frequency. And
Again, this is courtesy of Dr. Ken Berry, who is also on YouTube. And I'm going to extend this because we've heard that, but here's another chart. And this was mentioned in the previous video, the Bristol stool chart. And it goes over the type 1, type 2, type 3, type 4, type 5, type 6, and type 7. So let's listen to Dr. Berry.
normal type of poop, never anything to worry about. Type 5, you have soft blobs with clear-cut edges.
Okay, that was discussed earlier, so I'm going to advance this. And we'll begin here.
When they really don't. A lot of people have seen the Bristol poop scale and they have type 1 poop and they think that that's definitive of constipation. But in many people, as I said earlier, they can have Bristol type 1, and as long as they don't have any of the other symptoms of constipation, that ain't constipation. So let's talk about what is constipation. First of all, constipation is not a diagnosis, it's a symptom. And so if you have these symptoms of constipation,
So again, it's not a diagnosis, but a symptom, according to Dr. Ken Berry.
constipation, then you need to talk to your doctor, because you may have an underlying diagnosis that is causing the symptom of constipation. So the Rome 3 diagnostic criteria, I think, are the best for diagnosing functional constipation. You have to have at least 2 of these symptoms to be formally diagnosed with constipation. So if you're straining, and I don't mean you just had to hold your breath and strain a little, I mean really straining.
That's key. Straining, I mean, you know what it means to strain. So that's one of the key topics he's speaking of.
To poop on at least 25% of your poop episodes, then that's one of the criteria for constipation. It doesn't mean you have it, you have to have at least 2 of these symptoms. The second is lumpy or hard stools at least 25% of the time. So you have to have A and B to be formally diagnosed with constipation, not just lumpy hard stools, but no straining. So
Okay, so the straining and then the lumpy hard. And you can review that at your leisure at Ken Berry on YouTube. Name of the title, Is My Poop Normal? And that's 2024. And I'm going to extend here.
you're going to have more poop that comes out when you poop, because you can't digest fiber and you can't digest a lot of the additives and a lot of the preservatives and colors and chemicals that are put in junk food. And so that's waste. That's something your body can't use, and so you're going to poop that out. Many people who switch their way of eating from eating standard American or some other high carbohydrate way of eating, which is full of junk that you can't absorb, therefore you have to poop out. When they switch to a ketogenic diet that's heavy in healthy fatty meats, or a ketovore diet, which is even higher in healthy fatty meats, or a carnivore diet, which is all meat, they notice that they just don't poop as much. They don't.
So he's discussing the different types of consumptions and quote unquote diets and the result of your waste. And I'm going to extend it towards the end.
Right? So some people have huge poops that are have a very large caliber. Other people have very tiny poops. Now the range that's normal. Nothing to worry about. Some people have small caliber poops. Some people have 12 gauge shotgun poops, and that's okay. What you want to look out for is any change in caliber, and it's typically so usually this is your normal caliber of poop. And now all of a sudden, for the last few weeks or months, you're having very small caliber poops. They're formed, but they're much smaller in caliber. That can be a sign that there's an obstruction, a blockage, or a growth somewhere.
That is very key. Always, and this is, to me, can be applied to many things. When there is a significant change or deviation from what you have seen as your norm.
In your lower large intestine, you need to probably talk to your doctor about any change in stool caliber.
Again, key. Consult with your physician.
So whatever your normal has been, that's okay, don't worry about that. But a change, a lessening in caliber, might need to have a conversation with your doctor. Also, if your poop has a specific dent or a groove in it, like it had to go by something to get out, again, there could be a growth in the lower part of your large intestine that's making that dent or that trench in your poop. Again, you probably need to talk to your doctor.
Okay, so I'm going to stop that right there. Again, that was Dr. Ken Berry, who is on YouTube as well. and speaks on many, many different things. But the takeaways here, basically, pay attention to your bodies. We're adults. We know, we see, well, I'm going to assume that most of us see exactly what it is that we consume. But are we really taking the time to examine what it is we expel? And when I say examine, I mean actually examining, looking. The odor, size, shape, any type of symptoms or deviations from what, as I mentioned earlier, has been your norm. If you find that there are changes, my suggestion to you is to not blow that off and to definitely consult with your physician, because it may not be anything major. It could be minor. It could also be a warning sign of something that could be major, or perhaps turn in or develop into something major. I understand this is difficult, uncomfortable, and for many, perhaps embarrassing. But remember, these are our bodies. And in time, they go through changes. With those changes, we should be aware. And I'm not going to say on high alert, but cognizant of those changes. And most importantly, being proactive in our health and the health of our loved ones. I do hope that this stream was informative and perhaps, just perhaps, can ease the level of comfort or discomfort some of you may have in these types of discussions. Thank you again to those who tuned in, and to those who may catch the replay. And congratulations to the gifted members. I do hope that you will join after the membership period is over. Enjoy this Sunday, this first day of September. Until next time, be safe, be well, and I know you know the rest by now. Be healthier. Bye-bye for now.